Natural solutions to reverse the hidden root of modern chronic diseases. Attention and urgency. Namaste. Today, I am not speaking about a supplement. I am speaking about one of the most dangerous silent biological processes of modern times. Insulin resistance. It is not just about blood sugar. It is not just about diabetes. Insulin resistance is now recognized as one of the central drivers of almost all major chronic diseases of our time. And chronic diseases today are the leading cause of death globally, extremely difficult to reverse once advanced, emotionally draining, financially devastating. The primary reason for rising global healthcare costs. Most people think diabetes is the disease, but insulin resistance begins silently 10 to 20 years before diabetes is diagnosed. During those silent years, it is already damaging blood vessels, brain tissue, liver, kidneys, hormonal systems, heart. Let me show you the breadth of its impact. Insulin resistance is strongly linked with prediabetes, type 2 diabetes, obesity, especially visceral obesity, fatty liver disease, NAFLD, NASH, hypertension, atherosclerosis, coronary artery disease, stroke, chronic kidney disease, PCOS, infertility, erectile dysfunction, Alzheimer's disease, sometimes called type 3 diabetes, vascular dementia, depression via inflammatory pathways, sleep apnea, gout, hyperuricemia, chronic inflammatory states, breast cancer, colon cancer, pancreatic cancer. When you see this list, you understand. Insulin resistance is not a sugar issue. It is a systemic metabolic signaling disorder. And once these diseases become advanced, they are difficult to treat. They require multiple medications. Complications increase. Costs escalate. So today, we are talking about prevention at the root level. What is happening inside the cell? Insulin is a messenger. It knocks on the cell door and says, "Open, let glucose enter." In insulin resistance, the lock becomes rusty. The door does not respond properly. The pancreas produces more insulin. Inflammation increases. Visceral fat accumulates. The liver overproduces glucose. Oxidative stress rises. Mitochondria become dysfunctional. This is the beginning of metabolic chaos. So the question becomes, can natural compounds help at this stage? Yes, but wisely. Let us explore each one scientifically. Apple cider vinegar. Apple cider vinegar contains acetic acid. It works by activating AMPK, similar pathway as metformin, reducing liver glucose output, slowing gastric emptying, reducing post-meal glucose spikes. Dose: 1 tablespoon in a full glass of water, before meals or bedtime. Trial duration: 8 to 12 weeks, best suited for prediabetes, post-meal glucose spikes, mild insulin resistance. Avoid if severe GERD, gastroparesis, chronic kidney disease, on insulin or sulfonylureas without monitoring. It is supportive, not curative. Instructions: morning, empty stomach. 1. Apple cider vinegar drink. How to prepare: 1 tablespoon raw apple cider vinegar, 250 milliliter warm water. Optional: few drops lemon. How to take: drink 15-20 minutes before breakfast. Why morning? Reduces post-breakfast glucose spike. Improves insulin sensitivity early in the day. Duration: 8 to 12 weeks. Then reassess fasting glucose. Avoid if severe GERD or gastritis. Fenugreek. Fenugreek contains soluble fiber and 4-hydroxyisoleucine. It slows carbohydrate absorption, improves insulin secretion, enhances insulin sensitivity. Dose: 5 to 15 grams daily. Duration: up to 3 months, then reassess. Helpful in early type 2 diabetes, PCOS, obesity-related insulin resistance. Avoid in pregnancy, high doses. Bleeding disorders, severe gut sensitivity. Evidence is moderate and clinically useful. Instructions. Option 1, soaked seeds. 1 tablespoon seeds. Soak overnight. Chew in morning or before lunch. Option 2, powder. 1 teaspoon powder. Mixed in warm water. 15-20 minutes before lunch. Why before meals? Slows carbohydrate absorption. Reduces post-meal glucose spike. Duration: 3 months trial. Ceylon cinnamon. Important. Use Ceylon cinnamon, not cassia. It improves insulin receptor signaling. Enhances GLUT4 transport. Reduces oxidative stress. Dose: 1 to 3 grams daily. Effect: modest reduction in fasting glucose. Avoid liver disease. On anticoagulants. Instructions: how to use. 1 to 2 teaspoon daily. Sprinkle in oatmeal. Add to tea. Add to turmeric milk. Best taken with meals. Avoid cassia cinnamon long-term. Green tea. Green tea contains EGCG. It improves fat oxidation. Reduces visceral fat. Lowers inflammation. Best when insulin resistance is associated with obesity. Dose: 2 to 3 cups daily. Avoid severe iron deficiency. Caffeine sensitivity. Instructions: breakfast or mid-morning 2. Green tea. Preparation: 1 teaspoon loose green tea. Steep in hot, not boiling water for 2 to 3 minutes. Best time: after breakfast or mid-morning. Why? Improves fat oxidation, reduces visceral fat, supports metabolism. Limit to 2 to 3 cups daily. Broccoli sprouts. Sulforaphane activates NRF2, the master antioxidant pathway. It reduces liver glucose production. Lowers oxidative stress. Improves metabolic signaling. Dose: 5,100 grams fresh sprouts, or standardized extract, one of the most promising natural metabolic modulators. Instructions: how to use. 5,100 grams fresh sprouts. Add to salad. Add lemon plus olive oil. Best time: with lunch. Why? Sulforaphane reduces liver glucose production. Activates antioxidant pathways. Ginger. Ginger reduces inflammation and modestly improves insulin sensitivity. Dose: 1-3 grams powder daily. Supportive but mild. Instructions: ginger add-on. Option: add 1-2 teaspoon grated ginger into turmeric milk or ginger tea after dinner. Supports digestion and reduces inflammation. Turmeric. How to potentiate its power. Curcumin reduces adipose inflammation and improves insulin receptor function, but bioavailability is low. To potentiate it, 1. Add black pepper. Piperine increases absorption dramatically. 2. Combine with healthy fats like ghee, butter, coconut oil, or olive oil. 3. Gentle heating improves solubility. Practical use: 1 teaspoon turmeric. Pinch black pepper. Mixed in warm milk with ghee. Therapeutic extract: 500 to 1,000 mg standardized curcumin. Avoid gallstones. On blood thinners. Severe GERD. Instructions: turmeric, most important preparation. Evening golden metabolic milk. How to prepare properly. 1. Heat 1 cup milk or almond milk. 2. Add 1 teaspoon turmeric powder. Pinch black pepper. 1 teaspoon ghee or olive oil. 3. Simmer gently for 2 to 3 minutes. Why this combination? Black pepper increases absorption. Fat improves bioavailability. Gentle heat activates compounds. Best time: after dinner or before bed. Why night? Reduces inflammation. improves insulin sensitivity, supports liver detox pathways. Who can try natural first? Best candidates. HbA1c 5.7, 6.4. Mild fasting glucose elevation. No complications. Strong commitment to lifestyle correction. Trial period. 3 to 6 months with monitoring. If improvement occurs, continue. If not, escalate. And when natural is not enough, do not rely on herbs alone if HbA1c above 7.5. Persistent fasting glucose above 150. Kidney damage. Neuropathy. Retinopathy. Type 1 diabetes. In these cases, medication is life-saving. Integrative medicine is not anti-drug. It is stage-appropriate medicine. The foundation remains. No supplement can replace. Resistance training. Visceral fat reduction. Proper sleep. Stress regulation. Protein-balanced meals. Reduction of refined carbohydrates. Supplements amplify discipline. They do not substitute it. Powerful closing invitation. Integrative and energy medicine focus. If insulin resistance is the soil, chronic disease is the tree. Instead of cutting branches with medication after medication, we must correct the soil early. At Holistic Wellness Foundation, IMFAL, we do not focus only on numbers. We focus on the entire human system, because metabolism is not just chemistry. It is also energy. Chronic stress, emotional suppression, poor sleep, sympathetic overdrive. All of these disturb hormonal signaling. When cortisol remains elevated, when the nervous system is constantly in fight or flight mode, insulin signaling becomes impaired. This is where energy medicine becomes powerful. Through guided meditation, breath regulation, nervous system balancing, 432 Hz therapeutic sound frequencies, mind-body regulation practices, light-based therapies, stress reversal techniques, PMF, terahertz, biophilia, bioresonance therapy, hydrogen therapy, steam sauna, NIR sauna, etc. We help the body return from chronic survival mode into parasympathetic healing mode. And when the nervous system calms, inflammation reduces, cortisol lowers, insulin sensitivity improves naturally, mitochondria function better. This is not mysticism. This is neuroendocrine physiology. Energy medicine does not replace medical care when required, but in early insulin resistance, when there is no organ damage, when lifestyle correction is possible, metabolic healing can occur without adding more drugs. We combine scientific nutritional correction, evidence-based natural compounds, movement therapy, stress regulation, cellular light therapies, meditation-based autonomic reset. This is true integrative prevention. Chronic disease is expensive, complex, and difficult to reverse once advanced. But early correction, through disciplined lifestyle, natural metabolic support, and energy regulation, is powerful. If you wish to assess your metabolic health before complications arise, if you want structured guidance rather than confusion, if you believe prevention is wiser than late treatment, you are most welcome at Holistic Wellness Foundation, IMFAL. Prevention is responsibility. Awareness is power. And balanced energy is the foundation of metabolic health. Thank you for listening with awareness. Take care of your metabolism. Take care of your nervous system. Take care of your future. Thank you once again. Founder, Holistic Wellness Foundation, IMFAL, Healing Beyond Boundaries.